Hi, I'm Rick Weisblatt with Harvard Pilgrim Healthcare, the Chief of Innovation and Strategy here. As a leading innovation healthcare company, Harvard Pilgrim is always looking for ways to bring better products and services to our members. One of the ways we do it is to engage our own staff to help us think through how to solve problems that our members or accounts are having. But just as importantly, we work with innovative entrepreneurial companies that themselves are bringing those kinds of solutions so we can meet with them, talk to them, and bring those solutions to our members. And we've got 4 great companies here today. They're going to talk about their company, their vision for the future, and how they make the healthcare system that we all use work better. I'm going to start by having each of them introduce themselves, and then we'll go into each company in more depth. Jacob.
Thank you. I'm Jake Saddlemeyer, co-founder and CEO of WellFrame.
Thanks, Rick. I'm Gary Gustafson with Limeade, Divisional Vice President of Customer Success. It's good to be with you today.
Hey, thanks, Rick. I'm Charlie O'Connell. I'm the founder and CEO of Glucosone.
And hi, everyone. My name is Andrew Lay. I'm the CEO and co-founder of Buoy Health.
All right, thanks very much. So we're going to start with a deeper dive into WellFrame, and I'm going to bring it over to Jake.
Great, thanks, Rick. WellFrame is a Boston-based company, and we partner with Harvard Pilgrim Healthcare to help modernize the approach to delivering clinical care management services to members with higher levels of clinical or behavioral health need. In particular, using digital to reimagine the kind of relationship that nurses and coaches and social workers working on behalf of Harvard Pilgrim can have, providing longitudinal support to higher risk members. We've got a short video to give you a sense of how it works.
Did you know that 80% of health outcomes are determined by what happens at home? But when it comes to managing a chronic medical condition like diabetes, patients need convenient, personalized, and holistic support to stay engaged in their health beyond the 4 walls of care delivery. That's where WellFrame comes in. WellFrame is a digital health management solution that supports people outside the walls of care delivery. Through the patented WellFrame platform, we help healthcare organizations support the whole person in one comprehensive solution, generate insights that enable early interventions, extend the reach of staff to engage more people, and deliver measurable value and continuous improvement. How does it work? WellFrame translates evidence-based, peer-reviewed guidelines and literature into a comprehensive clinical program. That clinical program is then delivered right to patients' mobile devices as an interactive daily checklist. Every morning, patients see exactly what they need to do that day to self-manage their diabetes, with tasks like medication reminders, recording biometrics and social determinant factors, and watching educational videos. As patients engage with the WellFrame app, their data is shared in real time with their care team through the Care Team dashboard. Advanced machine learning algorithms prioritize patients by need, generate alerts, and recommend follow-up actions. WellFrame also facilitates secure messaging between care teams and patients. So when a clinician sees the patient is in need of support, they can respond with timely, personalized guidance. As a result, care teams can build meaningful relationships that drive patient satisfaction and adherence. WellFrame's health management platform empowers care teams to engage more patients more effectively without adding more staff. Learn how WellFrame can help you support patients beyond the walls of care delivery with digital health management.
And we're back. So Jake, obviously Harvard Pilgrim thinks you've got a cool solution. That's why we're working with you. Why don't you say a little bit more about the journey you took, what you learned, the years it took for you to launch this solution, and then how you're measuring your successes as you move forward.
Yeah, absolutely. So I'm an epidemiologist by training and had focused a lot on understanding the relationship between lifestyle behavior and chronic disease risk and prevention and management. I got together with a primary care physician and computer scientist and data scientist, and our vision was really how do we advance new ways of using technology to help better organize the resources of the healthcare system around the needs of people kind of in between formal interaction. And so we really see technology, whether it's through mobile or data or otherwise, not as a way of replacing human care, but extending therapeutic relationships and enabling clinical resources to provide a level of ongoing support that's higher touch and more convenient and ultimately more effective. And so we were more coming from the academic background initially, and so we started with clinical trials to demonstrate the effectiveness and the feasibility and the acceptability of the platform, and then ultimately leverage some of those results to start working with organizations like yours from a commercial perspective, really with the aim of increasing the capacity and effectiveness of your teams. And so some of the areas that we think about from a value perspective, one is, are we meeting people where they're at and allowing them to engage and participate on their own time in their own space in a way that works for their lives and their preferences? And I think we see mobile has emerged as a kind of preferred channel for communication and engagement in every other aspect of life, but one that hadn't been used in the context of clinical services like care management as much. And so we saw a real need to close the gap between the way the system was deploying services and what people's preferences look like. So we look at everything from the efficiency and the capacity of the team to all sorts of measures around how people interact with the care program and relate to their care manager, from the number of touch points to the overall engagement and compliance to retention in programs and people's experience in programs, and then ultimately look at the effectiveness of the service in terms of shifting utilization in favorable ways. And so increasing consumption of preventative services, ultimately reducing overall cost and improving outcomes from both the clinical and quality perspective. And given my background, we tend to be very rigorous about how we measure that with our partners so that you're able to communicate those results to your stakeholders, whether they're accounts or otherwise.
So is it hard to go from the pristine land of academia into starting a business and launching it and finding customers and the rest of that?
Yeah, it was a big difference, and it definitely took some time. But I think that we were motivated and continue to be motivated to make an impact. And so you see some folks when they start businesses, they see a very specific financial wrinkle that they want to iron out, and it's a business model oriented approach. Ours was much more around, we want to make an impact, and it ultimately became clear that by being a for-profit company and ultimately a venture-backed company, and by partnering with folks commercially, it allowed us to expand that impact. Right. And we could really align doing well and doing good. And so it took some time to do that, but I think because we really focused on meeting what I see as a core human need, where people are going through periods of vulnerability and they're looking for that, emotional and relational and clinical support, making that easier has allowed us to operate with our partners across a lot of different domains. And so, we're working to support everything from folks leaving the hospital after an admission to managing chronic conditions to, managing behavioral health challenges and you name it. And so the principles have been applicable in a lot of different contexts.
That's great. Yeah. Thank you. Okay, we're going to turn to our next company, Gary and Limeade.
Thank you, Rick. Limeade was founded with the idea that we can measurably improve the well-being of the world. And we're a software company that elevates the employee experience by focusing on whole person well-being. I brought a short video that will explain what we do in a nutshell.
Great.
How your employees feel when they walk into work, while they're on the job, and when they leave for the day. This is the simple definition of employee experience. Elevating the employee experience is a bit more complex. The thousands of unique interactions they have with the company, the people they work with, the tools they use, and the work they do, all have a profound effect on an employee's experience. Moments like these deserve to be supported. Making employees feel welcome, valued, recognized, heard, taken care of, and treated like human beings. Building a sense of community and connection with others while providing easy access to benefits and support and the tools they need to help make work even better. Enabling a sense of purpose and path to advancement. Access to mentors that openly share their wisdom and helping them become good managers and mentors as well. Improving physical, emotional, and financial well-being with personal support from the entire company and ultimately helping employees feel like it's all been worthwhile. Limeade is there at all the right moments to help elevate the employee experience so employees know that the company cares, because creating a culture that's good for people is also good for business.
Let's That's very interesting. That's great, Gary. Thank you. So you're talking a lot about employees and the workforce. So say more about what employers can expect to get out of this, and how do you talk to them about how employee well-being can drive better business results?
Thank you. We want to empower our employer customers to be able to let their employees know that they care about them. Mm-hmm. When employees feel cared about and valued at work, they're more likely to invest in the organization, and that drives business results ultimately. And so when we talk about engagement, we're not just talking about participation in a wellness program or a well-being program. We're talking about a deep sense of connection that happens between an employee and their employer. And when I come to work, I'm very passionate about what I do. I love what I do. I think about what I do even when I'm not at work. And I would consider myself an engaged employee. But we know that the world of work is broken today. There's a lot of stress. Employees are under a lot of pressure, and that leads to healthcare issues and problems. We know that 50% of all medical issues have a comorbidity of stress. And so if we can attack those issues from a whole person standpoint and surround our employees with organizational support that includes leaders, managers, teams, peers, alignment with their objectives at work, with their strategies, we feel like we can impact and make the employee experience better and also improve the well-being of the world.
Well, it certainly makes sense. I know that the leadership group at Harvard Pilgrim here talks all the time about employee culture and what we can do to create a more engaged and employee that wants to stay here and work here. I would be remiss, I think, if I didn't ask you about the name. So how did you come up with Limeade?
That's a great question, and you're not the first one to ask about that. But our founder, Henry Albrecht, interestingly enough, he was, before he started the company, he was very stressed out. And he was in a hotel room. He'd been on the road extensively. He was arguing with his wife more than he wanted to. He looked in the mirror and he had a rash on his cheek from all of the stress and everything that he was going through. And he said, I think I can do better. I can do different. This is not what work should be. And so he stepped away and designed the company. And he wanted to differentiate what he created from standard well-being and wellness programs at the time. He wanted it to be fresh and alive and different and not just focused on healthcare. That's what everybody else was doing. He wanted it to be a whole person approach to well-being. And so that's where the name Limeade came from.
I see. Thank you. Okay, next we're going to talk to Charlie from Fitscript Glucosone. Charlie, take it away.
Great, thank you, Rick. I'm really happy to be here. It's awesome to be on this panel with like-minded entrepreneurs. Glucosone is a clinically validated digital therapeutic for diabetes. We are pioneering the prescription of apps instead of drugs to improve health outcomes and lower costs for people living with diabetes. Ultimately, we have a vision of being a global healthcare company providing healthcare services across the world through the global digital economy. I've got a couple slides here just to kind of paint a little bit of a picture of why does glucosone exist and what is the value that we bring to the current healthcare paradigm. So, since 2005, over 40 different drugs have been brought to the market for diabetes. And not only have diabetes results not gotten any better, they've actually gotten worse. There are more people with A1Cs above 7. There are more people with A1Cs above 9. There's something wrong with this picture. And the American Diabetes Association just did an actual longitudinal study of studying the impact of all of these pharmaceuticals being brought to market. How are they actually affecting diabetes and controlling diabetes? And the frustrating news is they're not. Okay? Costs are out of control, and actual health outcomes are worse. Okay? So why would that be? Well, one of the reasons why is because all of those medications that have been brought to market since 2005 are actually indicated as adjunct to diet and exercise. And adjunct is a very exquisitely negotiated term with the FDA. Okay? And what adjunct means is secondary. They're secondary to the primary therapies of diabetes, which are diet and exercise. Okay? Now, everybody knows that exercise is good for diabetes. What's not as well known or nearly supported is that exercise is different for people living with diabetes, starting with the need to test their blood sugar and manage their medications. And the reality is that depending on what your blood sugar level is, it may or may not be safe to exercise. It may or may not be safe to perform certain types of exercise. And when you start to factor in medication profiles, comorbidity conditions, types of diabetes, environmental elements like the weather, it starts to become clear that diabetes actually has some very unique exercise challenges and requirements. If a patient's blood sugar level is 200, they fundamentally require a different solution than if their blood sugar level is 100 in real time. Or let's say you had two patients and both had a blood sugar level of 200, but one was on insulin and metformin and the other one was on Victoza and metformin. Even though both of those patients have the same blood sugar level of 200, because they're on different medication profiles, they require different solutions. And many patients, nearly every single patient is told by their doctor, you need to go get exercise. All of these medications are indicated as adjuncts to exercise. But the reality is, if you have a patient with type 2 diabetes who's on insulin and metformin, and they have neuropathy in their feet, and they live in Boston, telling that person to go for a walk, that's just not a realistic scenario for success. Okay? And it actually leads to lack of compliance and other very frustrating results. So we have tried to address that. That's actually an opportunity. When you look at the treatment triangle of diabetes, which is medication, nutrition, and exercise, billions of dollars have been invested in the pharmaceutical aspect. The same thing can be said for the medication component. Almost nothing has been invested to support these unique fitness requirements of diabetes. And so that's what actually Glucozone does. Glucozone, we are as pure a digital health solution as there is. It's an app, and it is a digital fitness app that gives exercise guidance based on the patient's real-time glucose levels and other biometrically relevant information. So that, if the patient's blood sugar level is 200, they're going to receive an appropriate fitness therapeutic based on that real-time information versus if they had a blood sugar level of 100. We've also set up Glucozone so that it works seamlessly for providers. Providers can monitor their patients' activity, success, and correlated information. So the way Glucozone works is it helps providers see not only what their blood sugar level was over a period of 3 months, but what was their medication usage, what was their activity correlated with that medication usage, what were their food habits. Our first clinical validation of this approach happened a couple years ago working with Yale. Basically, Yale identified patients with type 2 diabetes who all had out-of-control diabetes and all were candidates for pharmaceutical escalation. And what we did was, instead of those patients being prescribed more drugs, they were prescribed an app. They were prescribed Glucozone. And we used A1C results to measure the efficacy of that approach. We also used weight loss. And we had really a transformative result out of that initial clinical validation. We had, across the patient board, an average A1C improvement of 2 points. That's not like 2 points in basketball. Okay, that's more like 2 points in the World Cup final. That is a fundamental change in the person's health outcomes. Also saw an average of 10 pounds of weight loss, which is clinically relevant because all of these patients were on hypoglycemic agents. Hypoglycemic agents are diabetes medications that have a side effect of low blood sugar. So from a health outcomes perspective, the results of that initial clinical validation were really astounding. Something else came out of that and caught everybody by surprise. And what came out of that initial clinical validation was all of those patients taking hypoglycemic agents started having to reduce the amount of medications that they were taking. The reduction in medication ended up being so dramatic that when it was put into a therapeutic perspective, there was an average full therapeutic reduction. Meaning if they were on 2 drugs before starting glucagon, after 90 days, they were on 1 drug. If they were on 1, they were on none. When that was put into a cost perspective, that ended up averaging a cost savings of over $8,000 per patient per year in pharmaceutical consumption cost reduction. And that caught everybody's attention, including Yale New Haven themselves. Yale New Haven is an employer. They're a self-insured employer. And one of the first steps that Yale took after these results were published was actually to make glucagon available to their employees who have diabetes. What we're looking at right here are just some of the examples of the impact on patient health and specifically cost reductions. What you see here is when you actually provide patients with tools for fitness therapy that's based on their real-time blood sugar levels and factors in their medications, you have astounding results. You know, one patient reduced their medication consumption by $39,000 a year. You know, another reduced by over $8,000, another by $2,000. So this, what glucagon represents for patients is the support they need to actually have success with fitness in the context of their diabetes. For payers and employers, glucagon represents really a game-changing tool that they can make available to their at-risk population to lower the costs associated with diabetes. And so maybe I'll just stop right there. And at a high level, that's what glucagon is all about.
That's great. I think we all read, talk, and worry about the obesity epidemic leading to the greater incidence of diabetes. And so you're certainly hitting a sweet spot of a real public health crisis in the country. Mm-hmm. Thank you. So let's now turn to Andrew and Bowie Health.
Great, thanks, Rick. So the problem that we're trying to solve is relatively simple, and it's the fact that people don't know what to do when they're sick. If you think back to the last time you had a cough or you had some knee pain or you have some tingling in your hand, you probably didn't really understand what to do. You didn't understand what you had. And at the end of the day, it's because we didn't send everybody to medical school to be taught that, right? We weren't taught how to triage a cough when we were going through grade school. And so what ends up happening is 72% of Americans do what everyone else does, which is they turn to Google. They go online, they search for their symptoms, they read information that is really meant to sell eyeballs to pharma. And what they read online, of the stuff they read online, 54% of that information is inaccurate. And what ends up happening is they mislead themselves into going to the wrong care at the wrong time. So if you just look at emergency room visits, 56% of them are non-urgent. 31% of urgent care visits could have been treated telephonically. 52% of primary care doctors report having a specialist referral demanded by the patient that wasn't actually suggested by the physician because of something they actually read online. And if they're not Googling, what other choices does a person have? They ask a loved one, what would you do when the loved one very likely isn't medically trained? And so if you kind of look at that inability for people to understand what to do when they're sick, it leads to significant cost. We had an employer look at all of their claims data and compare it to where that claim ought to have gone. And they saw $8.5 million of waste per 10,000 employees per year. So what we built is we built an AI program that interviews patients like a doctor. And after about a 2 or 3 minute interview, it narrows the world of diagnoses down to 3. And then based on the employer or health plan's specific network design, as well as all of their carved out solutions, including telemedicine, diabetes management, smoking cessation, et cetera, hands them off directly into the perfect service when the person actually needs it and when it's actually clinically relevant. So I'm going to show you a quick demo video of what that looks like.
Great.
So the program can fit on any portal, whether that be your HR portal or Wellness Hub. People click over to use the program. It's a web mobile optimized product, so it fits on any browser. It starts by asking you some relatively simple demographic questions. It then goes into a search for your symptoms. That's actually been machine learned with over 30 million unique searches that have already happened on Buoy. It then goes into this dynamic interview. And the interview is essentially saying, of the thousands of questions a physician could ask, which one is statistically most relevant? It asks that question. And it basically readjusts in real time to say, okay, of the thousands of questions I have left, which next one is most appropriate? We were developed at the Harvard Innovation Lab here locally. What that means is I gave a lot of stock options to a lot of professors who taught us how to think about the program. It's built off of a bed of clinical literature, thousands of clinical papers. And after about a 2-3 minute interview, we narrow the world of diagnoses down to a max of 3. Reasons for and against each diagnosis, the recommended level of care, and then with the partner, the ability to hand off into that particular partner's ecosystem of services. We actually started out selling to health systems as a front door to booking a provider. And what we actually found was significant reduction in people's desire for care. It turns out that fear and confusion are major drivers of healthcare consumption. So if you help someone better understand what is going on with them, it leads to results that we saw with Freighter, a big health system in Milwaukee. We saw a 50% reduction in the desire for the ER, a 48% reduction in urgent care, 42 in primary and 60 in telemedicine. And when you looked at the pre-post of what people would have done versus what they did after using Buoy, we were seeing about $174 of cost savings every single time someone touched the product, but a net promoter score of 80.4. So we sell to employers and health systems. We're constantly looking at ways of driving efficiency by better having their employees and members better utilize the services that they've so carefully curated. That's what we're up to.
And of course, we hope to bring it to a health plan called Harvard Pilgrim.
Exactly.
As we work with you. You know, what strikes me about your solution is that I meet often with providers, and their emergency rooms, they all say, are booked solid, overcrowded, and 1/3 to 2/3 don't need to be there.
Right.
And it creates a dissatisfaction, because if you don't really need to be there and you don't have a serious condition, you could wait 2, 3, 4 hours because of more serious conditions that hit the ER. So it seems like that'd be a great solution. And also, people tend to have smaller families and they don't live near their parents, aunts and uncles that, you know, in the past I think would probably be able to answer some of the questions, or at least be a little more blasé about the little rash on the neck, right?
Right.
So I'm sure it's of a great value. So on Monday, I happened to play in the Harvard Pilgrim Broker Golf Tournament. And I was playing with the brokers, and this is our thank you to them for the work they do for us. And there was a point to this, I promise. And I made the mistake of telling the person I was in the cart with that I had trained as a psychologist, and you know that's what I used to do. And he asked, though, a very interesting question that I'm going to ask all of you, which is, can people really change their behavior when they're heading in a certain direction, when they're struggling with compliance with whatever diabetes or whatever other illness they have? You know, we can have care managers call, we can put cool apps in their hands, but how do you all think about changing people's behavior, and how are you thinking about demonstrating that so we can, you know, create a culture where people believe that they, you know, that they can change and they're not just victims of whatever medical condition they might have? Jake, why don't we start with you, if that's okay?
Sure. Well, I think the answer is yes, absolutely. They can change behavior, and people do it all the time. But I think you also have to be realistic about what behaviors people want to change and what behaviors they're motivated to change, and not kind of push the rope on people that don't want to change certain things. So I think if you can make it easier for people to do things that they already want to do, you can change behavior significantly. But I think if you try to push people to do things that you want to do that they don't, then I think you're really swimming upstream. So when we think about the use of technology, there's obviously a much broader context for any behavior that somebody has. And if you consider kind of the choice architecture around those decisions and those behaviors, you need to be thoughtful about where are you facilitating or making it easier for someone to get at something that they want, which will necessitate a change of behavior or lend to a change of behavior, and where are you pushing someone to do something that they don't want to at all. And so I think you have to be realistic about what behaviors are conducive to change and where people are motivated to get certain goals and can use digital, in this case, for instance, to facilitate that, but not think that you're going to categorically change somebody's day-to-day just because it's in your best interest.
Right. And so how do you think about keeping them engaged? Because
Sure.
whether it's weight loss or lots of other things, you'll see people get engaged, they exercise for a bit. I mean, gyms live on the fact that people join in January, they go through March, and they're never there again. So how do you keep people engaged in that change?
Sure. Well, so typically the kind of folks that are engaged in our platform tend to have a relatively high level of clinical or emotional need. They're interacting with healthcare resources on the regular. They have complications within their own lives that are making it really hard to do a lot of things. And so when we thought about the use of technology, we said for these individuals, really going through periods of vulnerability, the number one thing that we can do is to help people to feel connected and cared for. And that means meeting emotional and relational needs, not just clinical and informational ones. And so the whole point of our platform is extending therapeutic support and relationships and helping people feel that sense of daily advocacy and guidance during periods where they're actually looking for help, right? And so, part of it is identifying the right population where they're struggling and that they actually need help, and then finding folks that are actually open to getting that, and then to making it really easy for them to get that support. And so in traditional care management programs, you're calling people on the phone and they're at work or they're with their family and they don't have time. One of the great advantages of using mobile as a conduit for that relationship is people can participate on their own time in their own space, and that might mean that the pattern of interaction is very different. But what we've ultimately shown is that when people are engaged through this type of channel, they stick with it a lot longer. The number of kind of touch points and interactions go up a lot, and the experience overall improves, and that ultimately lends to a more effective service. And so I think our thought is like trying to make it easier for people to get support that they're actually looking for, as opposed to driving towards something that people aren't.
Great. And Gary, I know Limeade takes a very broad approach to the employee base and helping an employer create a culture of wellness. And so you're interacting with folks at every level, healthy, less than healthy. So how do you all think about both creating and sustaining healthier behavior change?
Yeah, we think a lot about this topic because it's the core of our business. And I think employers are fooling themselves if they think they can buy a piece of software and expect to change human behavior. Well, I've got the software. Why am I not seeing the huge results that I've anticipated or I've told my board that we're going to get? Traditional wellness approach has been focused around outcomes-based, and that's the situation where you have to meet a certain biometric criteria to get an incentive, and if you don't meet that as an employee, you have to enroll in some sort of program, remedial program to make sure that your numbers are moving in the right direction. And that's like being in a relationship where your partner comes to you and says, honey, listen, I noticed on your last screening results that your biomarkers are a little bit out of whack. And until you bring those into line, I'm not going to take you to dinner or a movie. And I want you to talk to a health coach and stuff before we continue in this relationship.
Are you suggesting that's a bad approach? Because I need to think about that.
You'll have to make your own assumptions on that. But for me, I wouldn't appreciate that kind of relationship. And I think what employers have done is pushed on their employees. And if I push on Jake, his immediate response is to push back on me. And so Jake mentioned caring for people. And if I feel cared about, and that's the primary motivation from my employer to me, I'm going to be invested in that relationship and feel if they're doing something for me rather than something to me, I'm going to have a higher likelihood of changing my behavior. And that's the premise of everything that we do. And so we've got to get rid of these punitive, ineffective programs that are forcing people to do things. Sure, they'll press the button to get the little pellet reward, but there's no lasting behavior change there.
Right. So I like the Skinner reference as a psychologist. So say a word about how Limeade does that. How does it create that caring touch with the employee so that it doesn't feel like employer big brother is managing your health?
So when we sit down with our employers, we try to get rid of all of the requirements. So it's in a lot of programs today, you have to get your screening, your health screening, and then you have to take your health risk assessment. We call it a well-being assessment. We get rid of those requirements. They're offered, but they're offered because the employer cares about their employee. And then we add incentives on top of that as an attraction. And then we offer whole person approach to well-being. Things like everything from food and nutrition and physical to as well as financial support, stress reduction, mindfulness, meditation, and then also interaction with your work environment. So what's your relationship with your manager? And we get managers and leaders involved. So it's an organizational approach, organizational support approach to whole person well-being.
Okay. So non-compliant diabetic is almost redundant, as you know, so many diabetics are. And you had some great statistics there earlier, Charlie. So talk a little bit about a diabetic who's really struggling. They've gone to different physicians, they've read, and they're really stuck. So you know, what's the approach?
What's the deal?
Yeah, to really get through to people whose non-compliant really could lead to some pretty nasty outcomes.
Right. So I've never met a person with diabetes who wanted to have out-of-control diabetes. Right? That person really doesn't exist. I've met many, many people who didn't know what to do about it. Okay? So that is a very important thing to just understand, right? Is that when people have problems, real problems like diabetes, serious conditions, and it's out of control, most likely they don't know what to do, okay? And so that is what we have attempted to do, is provide people, what do you do? What do I do with this problem? And in our case, technology has enabled us to be able to do that based on their real-time and contemporaneous biometric information. And that's really what's exciting about digital health, is that with things like a smartwatch and a continuous glucose monitor, you can give very, very individualized, targeted guidance that the person can immediately benefit from. And what you're doing is you're meeting the patient where they are. There's another thing that I'll throw out, since we're talking a little bit about psychology and personal change. We have found that our digital-only users of GlucoseZone consistently have much, much, much better health outcomes than in-person performance, okay? Meeting with a trainer, and you mentioned the gym. And for a long time, that really confused me, because in our case, we actually have a fitness laboratory. It's like a boutique fitness studio specific for diabetes. And we have some phenomenal trainers who are, you know, master's degree and above, exercise physiologists, nutritionists, and consistently the online user base outperforming those in person. And that really confused me until I realized something. And this is why I think digital health is such an exciting now kind of next scape in healthcare. There is a subtle but incredibly important difference between an in-person interaction with a doctor or a psychologist or a trainer versus the interaction with a digital tool. And what the difference is with the digital tool, there is no transference of responsibility. Okay? What I mean by that is, let's say that you're 20 pounds overweight, okay? And you go to see a trainer. There's subconsciously, or even many times consciously, the transference of responsibility to that trainer. You're gonna make me lose 20 pounds. You've transferred that responsibility. Now, trainer Rick, it's your responsibility for me to lose 20 pounds. Dr. Rick, it's your responsibility to help me work through these issues of depression, anxiety, alcoholism, whatever it is that we're talking about that's behavior related. In the case of digital, there is no transference of responsibility. A digital tool is exactly that. It's a tool that the patient, when they're ready, can use. And by its very nature, the patient wouldn't be using the digital tool if they weren't interested in changing the outcome, if they weren't taking responsibility for their own behavior change. And that's, I think, a very important element that has to be talked about in this conversation about, well, how do you help people make behavior change? Is recognizing, number one, and we're totally focused on diabetes, so only talk about diabetes. We've never met anybody who wanted to have out-of-control diabetes. They don't know what to do about it. That's number one. And then number two, provide them with a digital tool that actually gives them guidance based on their individual biometric information. And when you do that, or in our case, we've really noticed astounding levels of compliance, of adherence, of engagement. In our case, we average 28 minutes per engagement on our app. We're not, Netflix. We're not doing TV, it's not Game of Thrones. Okay, this is a clinical therapeutic for their diabetes. On average, they're engaging with 28 minutes. It's because it's individualized, targeted, based on biometric information, and providing them with a very specific solution for the problem that they have.
Right. And Andrew, obviously, you guys think a lot about behavior change. One, to help people use the application to understand what it is they may have, but then also think about where to go and how to get the care they need. So how do you guys think about it, and how do you track it and understand it better? And how do you use the AI to improve the app? Because you can see what people do or don't do, or at least they tell you. So it seems like that's a feedback loop that would be pretty important to Buoy.
Yeah, that's a really good point, Rick. So the way that we quantify behavior change is actually right when someone starts using Buoy, we ask them, what kind of care are you looking for? And then after they complete the program, we are now offering them different services, and we can also just directly ask them, where are you headed now? And you can start to see the delta between what they would have done and then what they did after having used Buoy. And where the AI and the machine learning becomes very interesting is, it's interesting you brought up Netflix. Our vision is actually to try to become the Netflix of healthcare. In other words, offer the exact service that someone with this particular mindset, with this particular clinical situation, is most likely going to respond to at this particular moment. And we just so happen to have had enough people use Buoy. We have about 6 million users on our kind of free consumer site that doesn't have the customization to the employer or health plan set of services. We have had enough users, had enough data to now start to model what people want over time, depending on their clinical situation. So, for instance, a 40-year-old man with moderate shoulder pain, he's not going to want to go to the doctor, based on our data, for about 130 hours. So this really highlights why it's so hard as an HR, someone who's in HR or someone who's running a health plan. How am I going to send a postcard about my MSK solution? Let's say I sent a postcard to about my MSK solution to this 40-year-old man, and he happened to have shoulder pain. right? That's amazing. What a fit. But if that postcard hit him in that first 130-hour window, he's going to throw it away. He's not ready to take care of whatever that is. But at exactly 130 hours, he actually switches and now wants to see a primary care doctor more at a higher rate than wanting to stay at home. So can you offer them the right service at the exact moment in which they are most likely going to want it, and ultimately change the downstream consumption curves of how people seek care? And so we think about behavior change. I mean, that's like ingrained in what we do and how we accomplish it.
You know, one of the things that comes to mind as you all talk is Steve Jobs, you know, early on before the phone, and saying he's not trying to give the consumers what they want now. He's trying to give them something that they're going to want in the future and don't even know they want it now. And one of the things that we know in our surveys of our members is that when we ask them what's most important to them, they want easier access to their physician. They want more time with their physician. They want to be able to get to specialists when they need it. And digital is much further down the line. In other words, I think a lot of people still don't know the potential that you all are bringing to the table. It just seems like, am I really going to get better through an app? So anyone can respond in any order, but how are you thinking about bringing your solutions and having them interact with the medical community in a way that a patient feels that they have whatever tool they're looking for, but still have some of the personal relationships that they might want and value, particularly as they get older, if they have a chronic illness? How do you all think about that?
I think that 5 years from now, that is not going to be the take. I think that the reality is that we are on the precipice of a full transformation in healthcare. And really, 80 to 90% of healthcare is information exchange. It's the patient, and I love the example, it's the patient communicating, I have this problem, or here's my symptoms, and it's the provider reacting and either asking more questions or providing solutions. It's obvious to me that smartphone, people are used to now getting information through their smartphone. Yeah. And why wouldn't their healthcare information be provided in the same way? Every day, billions of people are doing FaceTime-like interactions with their friends, their families, their teachers. It's only a matter of time that the customer expectation is, why is this not on my phone? Why do I have to wait 3 weeks to see my primary care physician? Isn't he available right now? I can Facebook him right now. I see he's on Facebook. Okay, I want to talk to him, right now. So I think that, we are really.
So you think we are at that tipping point?
I think we are. Yeah, I think for sure.
How about others have a comment?
Yeah, I like where Charlie's going and absolutely agree with his assessment. I was looking at some data this week about cell phone, mobile phone statistics in the United States. And it was 92% of all adults have some sort of cellular device, and 77% of adults have a smartphone. So to Charlie's point, consumers expect now to have an Amazon-like experience or a Facebook-like experience in virtually all of their transactions electronically. And I think the challenge is going to be bringing the dearth of apps and all of the things that employers throw at their employees, bringing them together in one place where it's relevant, it's timely, it's where the consumer needs it, right? Because right now, you think about how HR and benefits people are communicating to their employees. They don't know if the message is getting through, and they know for certain that a huge portion of their employees are not reading the material that they're spending so much time and effort to produce.
Right.
And we've got to think differently about that and bring that together in a consolidated format and then wrap it in a social wrapper such that employees want to go out and consume it. And Limeade has some thoughts on how we're doing that.
Right.
And if you think about what's driving the response from your members, right? They want to have access to care when they need it, and they want it to be easy. And so, but I think that there is a change management that has to happen, and I don't think in every respect it happens overnight, right? And if you look at consumption of other types of services through mobile, like it hasn't always taken form right away, and especially if you look at the populations of need within healthcare, they're not always the earliest adopters of certain technology. And so if you think about, Uber and Lyft took off really quickly, it didn't start with 70-year-olds with multiple comorbidities and income restrictions, right? But it got there, or it's getting there. And so I think that is a challenge that you can't ignore, that you can't take a look at some of the populations within healthcare that have the highest levels of need and assume that they're going to adopt new technologies in the same way that typical early adoption populations are. And so for us, those are the populations that we typically focus on. It has to be really easy. It has to come with service. It has to come with support. You have to help people get over that hump. And over time, you look at a growing proportion of folks are opting into that type of support. And so when we started, people said, you guys are stupid because older, sicker, poorer people will never use smartphones to manage their health. And now we're at the point, as an organization delivering clinical support to folks, it's almost irresponsible not to be leading with that as a primary channel. And in fact, the vast majority of those people from our observations are preferring to get support in that way. And that's taken 5 years, right? And I think in another 5 years, it'll be totally different still. And so I think that given the populations that are typically a focus and that matter to employers or to health plans or to providers, given the cost distribution within healthcare and the risk distribution within healthcare, I think you have to think a little bit differently about what that adoption curve looks like.
Go ahead.
No, I just wanted to add, well, first, just to respond to Jake, what you just said, I think so many people kind of assume like what we're doing is only fit for millennials. We know for a fact that over 20% of our users are over the age of 65. And the fastest growing population on Facebook are over 65. Right. So I think we often underestimate at this point how technically savvy different populations are, different generations are. The one nuance I want to just add to the conversation is that as digital becomes a bigger piece of healthcare, healthcare I think is just a really interestingly different beast than many other marketplaces. Let's say, because at the end of the day, you just don't know what you want. So that the fact that you're talking about, they want access, they want to see a specialist, right? Why? And if you think, I think the best comparison is to like a going to a mechanic. When your car is broken, it's just broken. So you bring it to the mechanic, and the mechanic tells you what's wrong for free, by the way, and then they're going to tell you how to fix it. And it's the demand for the service is actually driven by an expert who's assessing what is going on. That's really similar to healthcare, right? Yeah, I know my knee hurts, but I don't know what it is that's going to fix it. And so when we think about this move to digital, I think one dangerous assumption is that people know what they want. So how can we better bridge that knowledge gap between what they actually need and what they think they need, because that is not the same thing.
I agree. Well, nobody thought they wanted a glass touchscreen phone.
Right.
And the 65-year-old today was 55, 54 when the iPhone came out. So they're not the 65-year-olds from 30 years ago. On the other hand, I've been reading annual reports of this year is the turning point, for digital for the last 10 years. But it does seem like a lot of the things that you all are doing, embedding AI or natural language processing or connecting the application to care management or working with employers who are desperately looking for ways to inculcate a healthier workforce, does make me think we're we're turning that corner because we have solutions that we didn't have before. So in the time we have left, I'd like you all to step back and think about your own company, but also the digital healthcare more broadly. And what do you think the future is? Where do you think we'll be in 10 years? What will be the big breakthroughs? Will we actually have fewer episodes of poor care? Will people actually be healthier? Because the point of all this is healthier lives, more longevity. To your point, Jake, earlier, we now know there are parts of the population whose health has worsened over the last 10 years and not gotten better. Their suicide is up, their health concerns are worse. So when you think out 10 years, will we be satisfied? Will we think we've really made a difference? Will people be healthier? Will they be managing with their chronic conditions better? What do you see on the horizon? And feel free to add what you think your company will be like in 10 years.
Well, we've got a limited amount of time left, so I'll keep it brief. I think that over the next 10 years, digital will fundamentally change the way people interact with and access care. I don't think it will necessarily fundamentally change people's day-to-day behaviors and their experience in life, full stop. I think there's so much environmentally, culturally, socially, and otherwise that's headwind against a lot of those things that I think it can help, but it's not going to transform that. But I do think in terms of the way people interact with the healthcare system, the way they find their way to the care, the way they interact with providers or sponsors of their care over time will dramatically change, and that'll improve the experience, I think, in healthcare for the better. And I think people will have a lot more information to understand what's going on and inform those decisions and hopefully make better ones. And for us, we've really, we've started in a relatively focused area where we've taken a service line that's delivering value and help to really kind of modernize that and augment that. And from here, it's about breaking down silos. And so we're working with our health plan partners to try to break down some of the silos between care management services and customer service and make it easier for people to get support across multiple domains in one place. And then we look at the kind of clinical support someone's getting from their health plan and the relationship they have with their physician, and we say that those ultimately need to come together and be more aligned, so it just feels like I'm getting advocacy from the system and they don't even almost know where it's coming from or what it's like. So that's a big ambition for us, and will occupy a lot of our time.
That makes sense. One of the companies that we're working with now is a primary care practice that is intending to be digital first. Mm-hmm. And you do think about when physicians start moving in that direction, there'll be a whole other cohort of patients that, now it's being prescribed or recommended by my physician. I'm actually interacting with my physician on FaceTime or on the phone or texting. I don't need to come in. And they actually don't need for me to come in. Yep. And health plans have found a way to pay them fairly so that they can practice in that way. Yep. So that's cool. Gary?
I think in 10 years, we're going to see a lot of the silos that currently exist in the employer space being torn down. When you look at how an employer supports an employee, you've got the HR function, you've got the benefits function, you've got the total rewards function, you've got the learning and development function, and those are all siloed programs.
Right.
And so employers need to tear those silos down. They need to bring those together so that they're supporting their employees, because the world of work is broken today. People aren't happy in their jobs and they want something different. And until we start investing in their well-being and truly meeting them where they are and surrounding them with organizational support, we're never going to be able to attack the healthcare issues and problems that are facing people. We have to treat them in a holistic manner.
Yeah, you've said that on a number of occasions, that whole person approach. People don't feel they're the same as whatever disease or problem that they have. That's not how they experience their own life.
That's right. And they bring all of that to work, and that impacts business. And so businesses need to treat their employees differently, especially in a market where talent is in such scarce supply, and demand is so high.
Right.
So,
Charlie?
Yeah, so I think 10 years from now, very clear to me, 10 years from now, digital therapeutics will be the standard of care for diabetes, and that pharmaceutical pharmaceuticals will be used as supplementary and secondary to data-driven therapeutic options.
Okay.
In 10 years, I think that Google will no longer be the front door of healthcare. I think that engagement is intrinsically hard, whether you're a health system, whether you're an employer, or whether you are a health plan, because at the end of the day, people turn to Google first when they need something. So when I think about all of the amazing services that are out there, whether they be diabetes management programs, chronic care management programs, smoking cessation programs, fantastic doctors versus okay doctors versus bad doctors. There are so many things out there right now that can really help people live a happier and healthier life. But the missing piece is the ability to get the person who could use that service appropriately to get to that service. And what's happening now is that they're turning to a search engine, and search engines aren't built as an on-ramp into healthcare. And if that gets replaced by whoever, I'm obviously suggesting that I hope to do that, or we hope to do that. Right. But if anything, it doesn't matter if it's buoy or not, could replace Google as that first step and then be that on-ramp, it would create massive efficiency for healthcare, for human society.
Thank you. And you know, from our perspective, the reason we like working with companies like yourselves is that we don't think the solutions are going to come from Google, Apple, Amazon. They'll take a certain approach that's not starting really from a deep knowledge of the patient. So I want to thank my panelists here today. I hope it's been entertaining and interesting and informative to the audience. And thank you all for being here, and thank you for attending. Bye-bye.